We still have to go a little bit more theory here before we jump into the computer, but I'm going to try to get through this to understand the nuances of the surgical guide, and then we're going to try to get onto the computer, and I'm going to walk through. We're going to design that surgical guide start to finish, bring in the files and create it. So in surgical guide, there's different modules we talked about. There's the denture module, the surgical guide module, the model editing. I like getting everybody used to jumping into the surgical guide advanced module. Because that gives us the most control. And so I don't find it super helpful when teaching people to start with the wizards and the basic version. I think it's best just to get into the advanced and learn the functions, because you have to be able to use those. When we open up Blue Sky, we're going to set what implant kit we're using. Again, Blue Sky is a program that's been developed to use multiple different surgical kits. So if you've got another kit, a lot of the kits are built in. We're using, it's called the Blue Sky Fully Guided Kit. It's that keyless kit that we showed. So you got to set it. Tell the program which one you're using. If we're doing lower arches, we can map the nerve so that the alveolar nerve is actually just traced and marked out right away. The software is getting automatic detection, so it's becoming just automatically detecting nerves. They've added some improvements there. The wag factor, that's that thing that we were just talking about as far as the play between the metal sleeve and the drill, and that little bit of play, you saw me wiggle that back and forth. That little bit of play increases the farther that we get away from the guide tube. So what are ways that we can combat this? Well, one is we want to think about shortest distance possible, and generally, as we all know, we're going to start with a small drill. And so the smallest drill is that 6mm drill. So 6mm drill is going to have less play. So when we punch through the cortex or punch through and start that osteotomy with a short drill, we've had less wag factor to begin with. We haven't grabbed the 13mm drill and tried to go right through the guide tube that can deviate off in different directions. We've started with a shorter drill. The other thing to consider is I'm going to encourage people to convert to actually not using a metal sleeve, because you could see the metal sleeve versus that drill, there's a little bit of play in there. I actually print the guides without the metal sleeve and then make it a little bit tighter so that there's a lot of engagement to the point where like you almost can't move and get any of that wag factor. So that's a personal preference where I like going without the metal sleeve, because the metal sleeve has a little bit of slop in there. So I'm going to show you guys how to do it without. Yeah, so that's where it all comes down to. I mean, we can make these things with what, hundreds of millimeters as far as the diameter there. So finding the diameter that is comfortable for you, that's where the printer calibration comes in, and choosing a size and a diameter that works well in your hands as far as the friction. Now, if you're talking about friction and heat, right, and considerable heat, this is how long that the drill should be in there, right? So quick pumping motions with copious irrigation, and my hand hasn't led to any considerable heat that I've noticed to be an issue with like friction or like, toast in the bone basically. So it should be quick pumping motions, just like all our osteotomies with copious irrigation, and that should minimize that. So I haven't experienced that to be an issue, but I've heard that come up before. And then on that note, when we calibrate and we figure out what's comfortable for us, the first couple guides that you print, what I suggest is making 3 guides. One as the default, and then one like 1/10 of a millimeter bigger, and one 1/10 of a millimeter smaller, and labeling them. And in your first couple surgeries, another guide is 50 cents of resin. And you bring those 3 to the table. And then you as the surgeon or your partner or whoever it may be can try all 3 of those on and run through those. And you build this this is the setting that I like with my printer, my hand skills, my preferences. So don't be afraid to print a couple. It's not $20 per guide, right? So that's, you pay $20 per export for as many guides as you want, unlimited guides on that patient, on that case. So don't be afraid to print a couple with 1/10 of a millimeter in diameter difference if you want to kind of fine tune how tight you like that drill to be.
I played around a little bit with outside irrigation, making separate channels for saline to go through the guide, which your assistant can actually use a monojet syringe and irrigate then. I can kind of go over it in my section a little bit too. And sometimes I've even played around with a little bit of lubricant, a tiny bit of Vaseline. It's not going to go inside the osteotomy because it's a fully guided kit. It just stays on the cylinder and the guide tube. So nothing wrong with that. We can actually play around with a few different ones. So, but we actually, just going standard surgically, haven't really had too much, issues with overheating temperature because they're in there for so little amount of time. You're engaging it without it spinning, so that decreases friction. It's spinning inside the guide for 2 or 3 seconds, and then you're done. That's where the multiple drills come into play.
Yeah, it should be 1-2 seconds, and then you're putting that drill back in the cassette and you're grabbing a new drill. So I can't imagine heating being a significant issue.